Hi, Joanne. My name's Cheryl.
Hi, Cheryl. Nice to meet you.
You
My
too.
pleasure.
So, obviously, we're here for counseling right now. Tell me a little bit about, why'd you seek counseling at this time?
Well, I found out that my spouse has HIV, and I was tested, and I also tested positive.
Okay.
And it's been a while now, and I'm having some symptoms and side effects, and I'm really not doing well.
Okay.
And I'm contemplating taking my life, but doing it with grace.
Mm-hmm.
And I thought maybe you could help guide me and maybe some advice in doing it. I don't want to feel pain. I don't want to hurt anymore. I don't want to have to take all these medications.
Okay.
So that's my starting
Okay.
point where I'd like to begin.
Well, I'd like to kind of start a little bit at the beginning instead of
Okay.
jumping right to the end.
Okay.
So within the marriage, you said you contracted HIV from your husband.
Correct.
Okay. Did you guys know going into the marriage that he was positive?
No.
Okay, so this was something new.
Right.
And what led to you guys deciding to get tested?
He had an extramarital affair,
Okay.
and then of course the relationship was a rocky road,
Mm-hmm.
and we tried to go to some counseling and work on the relationship and things, and he went for physical for work,
Mm-hmm.
and at the physical they do the blood tests and chest x-ray and all, and he showed positive at work.
Okay.
So once that happened, and I wasn't pleased that it took him a little while to share that with me.
How
but
long
fine.
did that take?
He probably held on to it about 2 weeks before he told me, which upset me more than I was already going to be upset. But, and then so at that point I made an appointment with my doctor, and I set up a physical and went in, and I suggested that they do all the tests, and they did, and came back also that I was positive.
Okay.
So with that, I'm having to deal with that because I feel that I was married to someone that I thought cared about me and loved me, and I've been let down. And now I'm left with this, and now I'm really not feeling well, and I just feel like I don't want to be in pain anymore.
Okay. So you're feeling unwell physically?
Physically.
Okay. Have you and your husband discussed at all what plans you would like to take regarding your diagnoses? Have you guys talked about this at all together as a couple?
Well, actually, no, we're kind of together, but we're not together because of all this. He's basically looking for his place, and I'm having a hard time getting around because it seems like I'm worse off than he is physically.
Mm-hmm.
I guess I got really hit hard, so it's affecting me physically more and quicker for some reason than him. I don't know why, but the doctor seems to think that I'm moving very quickly,
Mm-hmm.
and that he wants to give me more medication for the discomfort and the pain, and I just told him I just don't think I want any more medication.
Okay. Now, so it somewhat sounds like you've begun the treatment regimen, and it's not, where are you with the medical process?
Right. The treatment, I'm on the treatment.
Okay.
And with that, I just don't want to feel the pain anymore.
Okay.
And that's why I decided, I feel like maybe if I do it this way, I can just bow out gracefully and not have to keep taking medication and going to the doctors. And now I can't work, so now I'm on disability, which then I have to go for disability checks, and that causes a lot of frustration. So I just feel like I've had enough.
How long have you been positive for? Or how long ago did you become, go and get tested?
I guess it's been over a year.
Okay.
over a year, and at first, you know, I was dealing with it and things, but then I started not feeling well. And when I went in, he told me that I actually had, you know, full-blown AIDS, I guess, and I'm feeling the symptoms and side effects.
So it has progressed from
It's
HIV.
progressed quickly,
Okay.
yes.
Now, you said you and your husband are together but not really together.
Right.
Where is your relationship status right now? What does
Um,
that exactly mean for you guys?
Well, that means that I basically told him to get out.
Okay.
And that, of course, I guess with good reason, I have a lot of blame and don't have really good feelings for him because I feel like he did this to me. And I feel like I would have never done that to him. Of course, you know, I mean, a lot of people cheat on their spouses and things, and a lot of people seem to think it's okay, but I'm really, you know, I haven't gotten over that, and then this, and I'm just, and now not feeling well, I just feel like I just can't take anymore.
So it sounds like there's still a lot of emotional hurt,
Oh, yes.
now added in with some physical hurt as well.
Right.
With your husband, did you guys discuss at all where he is going with his diagnosis?
Not really. I haven't spoken to him much, but I do see from, you know, he's trying to get his things together because he's trying to find his own
Mhm.
place. I'm gonna stay here, until the end, but he doesn't seem to be, doing as badly, or it doesn't seem to be progressing as quickly as is with me, so even though, I don't know why, but it's just the difference, and I just don't wanna feel the pain anymore.
So I'm interested to know, what are some of the other options that you've weighed for yourself? Because of an end-of-life decision is a big decision to make.
Well, I used to be very faithful, and since this, I've kind of lost a little bit of faith. I tried going to some Christian counselors at my church, and when I even mention end of life, they get a little upset, and they say, no, you have to keep the faith and keep the hope, but I don't know, I just don't feel like maybe they're listening to me, what I really want, what I
Okay.
really want. They want me to do, and it's wonderful, you know, keep the faith, but what faith?
So you've sought out counseling
So that
through
yeah.
the church.
Yes.
What other, now you said you've been diagnosed for a year, that you've been doing the medical treatments, and that you've sought counseling. Have you tried any other pain relief techniques or management programs?
When I was complaining about the pain and discomfort, the doctor told me to try acupuncture.
Okay.
I tried an acupuncturist down in Fort Lauderdale. There's a school, so
Mhm.
someone sent me down, Dr. Who or Dr. He, I'm sorry, I
Mhm.
forget his name. But I went down and I tried it, and I mean, it was okay in the beginning, but then after, I was gonna have to start the pills again, and I don't know why, it's just I feel a lot of pain, and I guess that's the disease, the progression, but I mean, and I've always been a go, go, go type person, and now I just feel like I just wanna sit, and that's no way to live, you know? And I've talked to my children. My children want what's best for me, and they just want me to be happy, so.
Well, I understand that this is a lot, and it sounds like you've really been processing it over the past year or so. And you said you came in for some guidance as to how to go about this process.
Yes.
I would feel most comfortable if we took some time to work on this, to make sure that any decisions you make are resolute, because this is a very big decision to make. So I would like to establish a treatment plan with you as to how about going through this, even before maybe we've finalized an end-of-life plan, to kind of unpack this, to help me make a better, you know, be a better counselor and a better partner with you. Would you be open to that?
I think so. I feel just from being here that maybe you're the first person that's ever listened to what I'm actually saying. And maybe if we talk, and maybe just that will make me feel better, and maybe we can get through it that way and help me with my decision.
All right. I think it'll be, it's going to be somewhat of a difficult process. We're going to talk about a lot, but I think together we can really make some good work, and hopefully I can help you come to some conclusions about what you choose to do. So why don't we schedule a time to sit down and make a treatment plan and start to do some clinical work together.
Okay.
All
That
right.
sounds great.
Thank you, Joanne.
Thank you for your time.
Have a nice afternoon.
Thanks. Bye-bye.